Hello, and welcome to DC's Panorama, a snapshot look at the issues we face under our current president, the administration, and Congress. I'm Maggie Linton, your host. DC's Panorama gives a voice to those who don't get a vote on the Hill. DC's Panorama digs deep into politics, arts, culture, our history, and issues facing metro area Washingtonians. Today's topic, healthcare, critical condition. Here's a taste of what our team found at healthcare rallies on the Hill, including lobbying for the cry for Medicare for all.
It is up to us to be that shining light and to tell everyone that we too can have healthcare as a right. The rest of the world has it. There's no reason we cannot have it.
Tens of millions of people will lose their health care. I don't think it saves money. I think it gives money from the poor and gives it to the wealthy.
A majority of Americans believe, as we do, in Medicare for all. But at the same time, Republicans behind me are working to take health care away from millions. The fear is palpable. You know it and I know it. Trump care will mean bankruptcy, unmet health care needs, and even death for so many Americans. Republicans know how bad this bill is. They know how poorly it is polling and how much it would hurt the American people. They know that passing Trump care threatens their majorities in the House and Senate in 2018 and threatens President Trump's re-election in 2020.
Medicare for all is a tremendous opportunity for all of us to begin to lead a life without fear.
Save Medicaid. Save Medicaid.
With the current state of our healthcare system, Washingtonians of all incomes and backgrounds are protecting their health coverage as a matter of life or death. Organizations like the Indivisible Project are trying to meet with the House and Senate members to share their side of the story.
I was low income, being a single mom, and getting laid off at previous times in my life. I had low income. Also, my son had a pre-existing condition, and at the time, this was the only type of health care we could get was what the state offered.
Nancy Solomon is just one of the many local residents who rely on the Affordable Care Act as their only health care option. Without health insurance, Washingtonians, along with all constituents of our nation, may face complete chaos. Laura Welch from Tacoma Park, Maryland, joined the Indivisible movement to try and stop the Senate from repealing our healthcare system. As a physician, she, along with many others in the medical field, volunteered to treat those who are uninsured. Welch not only worries about the financial consequences to her patients, but also to the district.
What this bill would do for all the three areas would put a $1 billion burden back onto the state and the district to pick up what the federal government's pulling out.
What happens here at our nation's capital will affect the health of our DC residents, as well as the finances of our local government. Here behind me at the Wilson Building, the seat of DC's government. With Double R Productions, I'm Yura Lee.
Thank you so much for joining us today. We have two very great guests. First, Dr. Pier Broadnax. She is an associate professor and the director of the RN to BS in Nursing program at the University of District of Columbia. And Tamara Smith. She is the executive director of DC's Primary Care Association. Welcome, both of you ladies, to this show.
Thank you.
We have so much to talk about. Healthcare, you can't turn on the TV without it being in the news. Right. Dr. Broadnax, I'm going to start with you.
Okay.
What state are we in right now with the healthcare issue? Because we've got a Congress and a president that just don't seem to understand, I should say, the Republican part of Congress.
Doesn't understand. Mm-hmm. The one word I would use would be divided. We're in a sad state, but we're divided against the haves, the have-nots, the ones who want to change, the ones who want things to remain the same. And the one word is just divided, no area for compromise or unwillingness to compromise. Questionable leadership. I mean, I would like to say something positive, but I'm straining at this point, and I hate to use the word sad because it brings up memories of other terms that other people use, but in a nutshell, divided.
Tamara?
I think, we're in a state of facts are not driving any of our decisions. And we're really in a potential state of crisis if the right decisions aren't made and if people's health care are really not taken seriously.
What's the state of DC healthcare right now?
Right now, I would say we are in pretty good shape. We have high insurance coverage rates. We have people that are accessing health care, but there are some problems. Mm-hmm. The disparity in chronic disease is very significant. It's based on race, it's based on ethnicity, it's based on income. In some wards of the city, the low birth weight, high disease of heart disease, hypertension, diabetes, it's a crisis. Obesity is a crisis. Pediatric diabetes is a crisis. So we really need to work on more preventive health. We need to work on getting more care out into the community and getting more individuals aware and involved in their health care. If this Affordable Care Act changes, we will be in a crisis situation because the district has been very innovative and expanded their programs and coverage. If that cuts back, the district will be in crisis. Millions, potentially billions of dollars will impact the city.
Now that the Senate vote has failed dramatically, not just kind of or almost dramatically, we look at the point where it is time to listen to everybody, not just talk and tell them what's going to happen. Am I right?
That's right.
When the plan was first developed, they chose not to involve the variety of ideas, so the plan was not well informed. It was a plan, but it wasn't a plan to address the needs or the relevancy of what the people in America in the district needed. So when you have limited input, you get a shallow plan without it addressing the critical needs, without addressing the areas of the Affordable Care Act, which needed strengthening or revising. It just ended up being a plan.
And I think the voices of the DC residents really need to be heard, the voices of DC government. There are more than 500,000 people in the district. 276,000 people have pre-existing conditions. They would be impacted by any major change in the Affordable Care Act. And so we really need to work together to make sure our voices are heard.
When you hear about the need for so much more, I think of the insurance companies who are also busy trying to bail out and not be a part of it. But how do you turn your back on millions of people, now over 30 million people who had not previously had any kind of health care that now have it? How do you do that?
We have to hold the insurance companies accountable. I think the Affordable Care Act did that. It's not perfect, but it certainly afforded many more people the opportunity to afford health insurance, to get coverage where they didn't have it before. It certainly brought options to individuals and really life and death options for people to really get the care they needed. And so I think we have to hold insurance companies accountable to being able to provide services in the market, to work with governments and work with individuals and really understand how we best meet the needs of our residents.
And when I think of the insurance companies, they focus primarily on numbers. And they don't see the face of the persons that are impacted by their decisions. So when you focus only on the bottom line to the exclusion of humans, to the exclusion of what will these decisions mean to those that are enrolled, then it's easy. You can just shuffle the numbers, you can make them work for whatever your goal is, but it doesn't get to what is needed in terms of why do you even enroll in insurance? What's the purpose of having insurance? And when Tamara says they must be held accountable, it's not just a simple plan. It's not just numbers, it's people, it's humans, it's quality of life, it's continuation of life. And when the insurance companies move from that, you end up with what we have.
I think about President Obama and when he first said right from the very beginning, this is not a perfect law. This is something that needs to be tweaked as well as shaped and formed. And one of the things, even as he was going out of office, he says, please leave in the certain specific conditions that are there. But let's talk about what are some of the things that definitely need to stay. You've mentioned a couple of them, but what are a couple of other things that definitely need to stay? And then let's look at what needs to be changed. Let's begin with what else needs to stay.
Number one, the coverage for young adults up to age 26 to stay on their parents' insurance. Coverage for pre-existing conditions. How many of us would be impacted if that was lost in a revised plan? Because if you don't have a condition at this point, as we mature,
you will.
We will.
Right.
You definitely will.
And I would add, the legislation really expanded coverage for single adults. Historically, we've had good coverage for women and children, but not for single adults. And this legislation impacted the district by really covering about 70,000 more individuals that are at up to 200% of poverty level. And so those 70,000 people would lose their coverage. The district would have to take on those costs if the act is repealed. So that's one of the things that we think really must stay.
When I think also of them talking about removing Medicaid, that impacts so many children and their families. And that's something that we also have to pay attention to.
Because it's not just the children who are here already, the preemies, prenatal care, the mothers fall if they are even middle class and have insurance. If the condition warrants, it meets the cap, then they fall out of whatever their status is into the need for Medicaid. So here we're talking about preborn and then the preemies and all the care that preemies require, from the neonatal intensive care to continuing ed to cognitive stimulations if they have, they end up having some types of deficits. So Medicaid is not just for those that you traditionally think of as the poor, but also, as you said, children. Right. And infants, and as they grow and what kind of services they will need. Right. And let's not forget the ones in the Medicaid population in the long-term care.
Exactly. So the district, because of the Affordable Care Act, really is almost 96% insured in the District of Columbia. So
and that's the highest numbers ever, isn't it?
That's the highest numbers ever. It's one of the highest in the country. And so we have been able to expand the Medicaid coverage to adults, to women, to children, to low-income families, up to 200% of poverty. Medicaid covers the aged, the disabled, the blind. So it's covering hundreds of thousands of people. And that legislation really helped the district expand their coverage.
Let's also talk about the people who care for you. Because just before we went on the air, we were talking about the importance of nurses. And you heading your program, you're helping bring us the nurses of the future.
Right. And the nurses of the future, they are going to require a different skill set. The patients are more complex. You think about patients who have not had health insurance and therefore access to health care, and they come with a wide range of complex illnesses. So you have to have nurses who are prepared at the bachelor's level, number one. Then you have nurse practitioners who have advanced training, who also act as primary care providers, and especially in those areas of low income, rural areas, who lack physicians. So, we are preparing nurses for the future, but in the 2018 budget, they're calling for a cut in the nursing education budget. So I always say, you want to cut nursing education, don't get sick.
Right.
Because you never know, the person who would have benefited from a nursing education can't afford to go to nursing school.
Right. And the DC Primary Care Association's members are about 15 federally qualified health centers. They provide care to about 200,000 residents in the District of Columbia, 1 in 4. So the healthcare workforce is huge. Yes. And the need for nurses and nurses, assistants, and care coordinators and doctors, the shortage is significant. And we need to encourage more people to go into the healthcare field, the nursing field, the medical field, all of the ancillary support services that we need, because we're growing and the needs are growing as the population ages.
And even as it ages, you find the need for qualified facilities also. And the facilities have to meet those standards too.
And see, when we think about the aging population and they're entering into an institutionalized environment, there are those who will wish to stay at home and age in place. So we need to have providers as well as a system to provide employment, livable wage for people who are caretakers, for those who are in facilities as well as those who are aging at home. It may be a formal or an informal caregiver, but just because you're caring for your grandmother, does that mean that you should not be able to secure employment or obtain a livable wage because you're doing it in-home care? Otherwise, they would have to go into a facility.
You know, the tobacco settlement money a few years ago really was the impetus for the development of primary care infrastructure in the District of Columbia. And what I can say is that there are a number of outstanding primary care clinics and healthcare services throughout the city. What we're missing oftentimes is urgent care and emergent care, specialty care out in the communities of Ward 7 and Ward 8. They call it the East End Desert. And so the primary care system is pretty solid, but it's the ancillary support services, the wraparound services that really district residents need to really maintain and improve their health.
And way too many people are still using the emergency room as their health care service.
Absolutely.
And some of that in the past, now you're saying so many of them now have the health care coverage, but in the past, they had no doctors, and that's how they got assigned a doctor, was going through the emergency room.
And speaking of nurses, you know, one of the ways that we're going to really get at that emergency room utilization reduction is through care coordinators. Oftentimes they're nurses, they're social workers, they are reaching out to patients, helping them understand, come into the health center, don't go to the emergency room. If they go to get hospitalized, working with them to make sure that they don't have a follow-up admission. And so the healthcare worker and the nurse in particular, care coordinators, they are essential healthcare workers to solve that problem.
As we work in collaboration with the DC Primary Care Association to build this role, to support one another in terms of building and care infrastructure, it cannot be taken lightly that even if you provide a hospital in Ward 7 or Ward 8, you still need the care coordination so that people don't come to the hospital because they don't know how to manage the medications. They don't know how to engage in self-care. They need some help with something. So as Tamara said, we have to have wraparound services, ancillary support, and it must be paid for. It can't be done with volunteers.
Absolutely. We have a vision of an integrated, you know, healthcare system, and as Dr. Broadnax said, it's about collaboration. It's about meeting the patient where their needs are, with the nurses, with the home health care, with all of those services. You know, there are many other factors that impact health other than just access to healthcare, housing, income, nutrition. All of these things have to be linked together.
And that's one of the hardest things to do. And when you look at also, again, the president doing the cutbacks, and it's already impacted so many people up to this point. And when you look at it, the overall impact, we see everybody receiving less and struggling more. And I think about the number of people who have been affected by medical costs and what can be done to help them. Because we know one of the main sources of bankruptcy, even to this day, is medical costs.
I think that's why, you know, health coverage is really important because none of us could pay for our health care out of our pocket. And, you know, so that insurance, whether it's Medicaid or Medicare or private insurance, is so essential. And it's a basic human right. Healthcare is a basic human right. And that's what we believe, and I know each of you believe that. So we have to protect that right.
For those who have it, and also for those who are struggling to have it.
Yes.
Right.
And so even though we are on the front lines, we lobby, we advocate, we write letters, we educate, we have not forgotten those who are not able to do that. Maybe they don't believe that they have a voice, so there is a need for programs like this to keep the public informed, but also to let them know what is your role, what can you do. You may not be interviewed, or you may not go and participate in a march, but there are things that you can do.
Well, let's talk about what people can do, because it's so important, and they feel helpless when it's like the David and Goliath. Right. But let's talk about what people can do to become more active. The charity begins at home, starts on the local level.
And when you spoke earlier about how we developed a plan without input, my mantra is don't let other people speak for you. You know, we want to speak for those without a voice. But people who are in the homes, build a coalition, build your own coalition with your family, your neighbors, your people in your apartment building. You know, keep them informed about what's going on. You know, get on the rah with your neighbors,
right,
and say they will not cut our services. We need whatever it is that you need, but build coalitions. Vote.
Oh, yes.
Vote.
Absolutely.
Vote.
and make your council members and the city council know what's important to you. You know, there's a lot of information online. There are many organizations that provide factual information about what the statistics are in the district. We still have a lot of disparity in health status, whether it's low birth weight, whether it's diabetes, whether it's heart disease, whether it's cancer. You know, there are many places we need people to address these issues and understand the issues. Go to the council, talk to the council, speak up for the rights of district residents. You know, go to the Hill, go to the marches, because our voices have to be heard, and we really have to, you know, fight and advocate for each other. It's not just our sole mission and our own interest. We have to care for the rest of this community and, you know, the future.
Education of the public is the most important thing. And it's hard for many of us to understand that, especially when I look at the Hill, Congress, things along those lines.
But those of us who are leaders, we need to let people know that, yes, you do have a voice.
Yes.
Start with your church. We always say start with your church. It's
Amen.
a time-worn strategy, but that's what we do. Start with your church. But I still say start with your neighbors. Grab your neighbor and say, come on, we're going to this city council meeting. We're going to we're going to write this letter. Or collaborate with your family members who live outside of the district who have voting representation, and get them on board.
That's right. One great thing I heard is, you know, more women and individuals are really thinking about running for office because they're sick and tired of what's going on.
They're sick and tired of being sick and tired.
Sick and tired of being sick and tired. And it's time for take up that band, that, you know, that arms and run for council, run for Congress, because we need people that care about, you know, individuals and the rights that we really deserve.
And we talk so much about, you know, Capitol Hill, but the district itself is in a bind because, and I call Congress the biggest slaveholders, because we still don't get, Eleanor Holmes Norton has been a valiant fighter on Capitol Hill, but when it comes to being able to vote, she still can't vote.
It's a basic human right.
That's
It is a human right. It is a social justice issue that individuals do not have the right to vote in the district. And I will tell you, I moved out of the city 25 years ago because I didn't have a right to vote. It is unconscionable, and this needs to stop.
Yeah, very true. As we look at the population in general, though, as you said, Tamara, a lot of them are now covered, but there are still those at risk. Who are they? What can be done for them?
Well, I see the unemployed young adult who is possibly not a family connected. Those over 55 but who are 64 fall into that gap.
Those that are just a little bit above the federal poverty level.
Yes.
You know, they're low-wage workers. They might be working in the service sector or the hospitality sector. They might work part-time. And so they don't have full access to insurance. They don't make enough money to really afford the insurance themselves. And so these are individuals that are at risk as well. Immigrant communities are at risk. There are language barriers and challenges. People sometimes don't even know what they have access to. So we have to do a better job, I think, of helping people know what they're eligible for and getting them enrolled as well.
And that's one of the hardest problems, touching those, because they're the ones, in a sense, that are in the shadows, that don't often want people to know how needy they are. And that's, again, when you're talk to that neighbor, talk to that friend, and stay in contact with them.
Absolutely.
We've got about a minute to go. Let's hear some final thoughts from both of you about what we want our listeners to get involved with and to do.
Well, when I think about preventive care, to me it says, how can we teach you to engage in healthier behaviors? We can't prevent the illness, it's rare, but we can help you to take better care of yourself. So I think that should be an emphasis, not to the exclusion of everything else, but how to care for you.
Absolutely. And I think we all have a right, a responsibility, and an ability to work on our own health and well-being, whether that's eating right, whether that's the exercise, going to your doctor. Many people don't go for preventive screens. Those are some of the things that were covered in the Affordable Care Act. Breast mammograms, colorectal screening, mammograms, all of those things. We need to take advantage of that. We need to work together as a system. It's not just doctors or nurses or hospitals or primary care. We have to integrate this system. We have to use technology. So let's be innovative, let's be collaborative, and let's take responsibility for our own health as well.
Let's get involved.
Let's get involved.
All right. Well, I want to thank you both for joining us on DC's Panorama. And thanks to you, our Washington area audience, for sending us your thoughts on this program and ideas for others. Send your comments to info@rrproductions.com. We thank the University of District of Columbia TV and executive producer Ed Jones for helping RR Productions present this program. DC's Panorama, giving a voice to those who don't get a vote.